Welcome to this 4-part series on sleep. We have divided it into 4 different segments because sleep is very important. At the same time, particular individuals will be interested sometimes only in one part of this aspect for immediate understanding. So the division has been based on the first part deals with the nature of sleep problems. The second part deals with the modern medical treatments available for sleep issues. The third part deals with the complications of sleep issues and comorbidities normally associated with sleep problems. In the final part, we discuss how clinically supported lifestyle correction can play a major role in helping overcome sleep disorders, especially with reference to Dr. Jolie Thomson's experience in this field. To begin with, the first question to Dr. Jolie Thomson is, what are the most common causes of sleep problems?
See, most common causes, you can say it is stress. If one day, if you are stressed, that day you won't be able to get sleep. Next is other diseases. If you have pain because of some disease or after an operation, you won't be able to sleep. The discomforts produced by other diseases is another most important cause. Next is psychiatric problems. This brain is controlling all the activities, and even the sleep also controlled by the brain. If the brain is affected, especially the psychiatric problems, the brain is affected, so the sleep can be affected. There can be excessive sleep or lack of sleep. Next is the medications we use. Many, even not only the psychiatric medicines, many medications have a side effect as decreased sleep or increased sleep also. So most of the cough syrups we use and the allergic medicines we use, one of the side effects is sedation and excessive sleep. Another, many of these antihypertensive medicines can cause decreased sleep. So these are the diseases and its medication and our stress factors and the sleep hygiene also, or even whether you're getting this light is actually a stimulant. So if you are not able to get darkness also, you won't get sleep. So when this electricity, after the age of the electricity, that is from 1800, 900 onwards, where all the housings are lit up. So even our common general older sleep pattern itself has changed.
See, we generally say that, sleep, if we are lacking sleep or if there is a sleep disorder, oftentimes the person who is suffering may not realize it, that they have a sleep disorder. Because they may be thinking they are sleeping well, but they may be having a sleep disorder. What are the common symptoms of sleep disorders?
See, the person, if it is he's not knowing whether he's not getting the sleep, that is mainly because it's the airway obstruction, sleep apnea, and they may be having snoring also. Because the person will not be knowing that he is not sleeping, because he is not hearing the snoring sound. And if someone is also sleeping with them, the snoring, they may be able to tell him. Or if a person is having snoring during sleep, that means he is not getting proper sleep, that the airway may be getting obstructed. And the sleep apnea, in between the sleep will be, breathing will be stopped, so the person will get up, and then again the breathing start, and it will be continuously, the person will be getting up because of the lack of oxygen. So in that case, what happens? Next day, there will be daytime sleepiness will be the problem. And many patients complains of this daytime, when they sit somewhere, they will sleep off. And the problem is when if it's driving, actually most of the accidents, and one of the major causes is this sleeping off while driving. And also the accidents can, especially when doing operating machines and all, if the person is not had enough sleep, they can sleep off. During this, they can get into accidents also. So the tiredness and fatigue and daytime sleepiness is the major symptom if it is a lack of sleep. And there are severe conditions like the person just to sleep off, and that is rare conditions like that. When a person just riding a cycle and fall off because of the sleepiness, the awakening factor. Actually, that is due to some receptor blockage and some sort of autoimmune disease. That sort of sleep disorder also is there. But the common is sleep apnea, snoring, and another thing is restless leg syndrome. The leg will be finding it uncomfortable, and the person may be moving the leg always, and during the sleep also. That is because of the circulation is getting affected on the leg, and also it's also the reason is not clear. It is also from the brain. It is centrally operated. Some mechanism is playing in that, or it can be because of the atherosclerosis, which is reducing the blood flow into the legs, and it makes the leg uncomfortable. That also actually can present as sleeplessness, and present as fatigue and daytime dozing off and regular life.
Actually, during sleep, what all happens in the body? Basically, because people generally feel that sleeping is something like an essential thing like breathing. You have to sleep this many hours. If you sleep this many hours, it is good for your health. But what is it that happens while you are sleeping?
See, actually, when you are sleeping, you are giving rest to the body. So even if some part of the brain and heart and all is functioning, but in a different way. When you are active, the muscular activity, the heart is pumping to give blood to the muscles mainly, and for the activities. But those things that while you are doing activities, those part is the most important. The brain also is focusing on keeping the alertness. In the contrary, when you are sleeping, the muscles are relaxed, and muscles doesn't need much circulation. So the circulation is focusing on maintaining the basic metabolism, basal metabolism, and even the digestion, the final part of the digestion, and most importantly, the immune system functioning. The immune system is actually doing all the repair works. In the daytime or when you are working, the immune system will be focusing on doing all the maintaining the alertness and defense activities. So we had to see that the skin is whether there is any pain, or if an insect bite is there. So such things, the immune system will be more conscious. But while sleeping, the repairing part of the immune system will be active. So all the damages which has happened on the day, it has to be repaired during the night. So those activities will not take place if you are not able to sleep. Even the removal of the toxins, even the cellular level, even the brain, there will be so much of toxins because of this metabolic activities, because the whole day your brain was working to keep the alertness and giving order to the muscles to do whatever way the activities. But in the night, the brain also needs some sort of sleep so that the brain repair, and also this removal of the toxins, that metabolic waste which is accumulated in the brain cells and neuronal cells also has to be removed. These activities will be affected if you are not getting enough sleep.
Actually, when you are talking about sleep, certain conditions, we expect those people to have a stronger variety of sleep. Something like, if a person is obese, or if a person has hypertension, or if a person has some other situation where he is fatigued or feeling tired, exhausted, we generally expect that person to sleep off like a log comfortably. But we hear that that is not true. If you are obese, or if you have hypertension, or if you are fatigued because of some chronic disorders, you don't seem to be able to sleep well. Who are the people who are generally more risk prone to develop such sleep disorders?
See, people who are having obesity are definitely having a chance for a sleep problem. That is usually sleep apnea, that is obstructive sleep apnea, because most of them will be having excess fat on the neck, especially around the oral cavity and also the trachea and all. So when actually our body is always alert to keep this air passages open. But when they sleep off, this with great, especially in the obese persons, with great alertness, the brain is maintaining the air passages open. But when they sleep off, they will just close it, and the air will not be going inside. That is so called actually sleep apnea. And when they, after some time, there is no air, the central system will wake up you, and again with a conscious effort, the sleep breathing will restart. That is one type of people. Another is stress. Usually, many people, if you anyone who is having stress, if you are about the project which has you had to complete, or the work pressure is there, or a family problem, that can definitely affect the sleeping. And next is, in the modern age, the problem is the electricity and the light, artificial lighting. So artificial lighting has changed all our older habit of the timing of the sleep and all. And now the problem is the screen time. Everyone is on the screen, either mobile or the computer, and that is actually, see, if you want to sleep, the first stimulus for the sleep is darkness. When the darkness comes, that melatonin hormone comes out, and that is the inducer of the sleep in the natural cycle. But if you are not putting off the light, or even after putting off the light, you are looking into the computer, on the mobile, or watching TV, then you won't be able to sleep. That is the major problem nowadays. So, and also because of the social media and so many activities in the night, you are engaged in so many activities. If you are in the city life, even the malls and everything will be open, and the next day, but you had to go for the work. In that also actually affecting the sleep irregularities and sleep problems, and gradually it will present with as other diseases. Next thing is the diseases itself. See, if you are diabetic, you may be taking medication and go to sleep, and you can get a hypoglycemic attack, and it will make you up, or even it will go into coma also. Both ways, the diabetic patients can get both ways problem: hypoglycemia and hyperglycemia. Both will affect the sleep, and also the hypoglycemia, it can go make you into unconscious also. Next is other diseases. Another type of diseases like which induce pain, if you arthritis, you won't be able to sleep. And also the medications which you are using, especially BP medications. BP, naturally when you go into sleep, the BP will come down. That is the pattern. We know that with the sleep study and all, the BP, when you are in sleep, the BP will come down. But if you are taking medicine and going to sleep, then the BP will be, the body will find it, even the internal system, the homeostasis mechanisms will find it difficult to keep the BP in normal range. So this different type of diseases, our lifestyle habits, and even the food, then the alcohol and smoking, and this caffeinated this beverages, all these things which you are taking also will affect the sleep, and definitely it will end up with other diseases also.
We generally hear, that many world leaders and so-called supermen, they sleep very little. At the same time, we also realize that, if we lack sleep, then it definitely affects the mental abilities of most of us. At least most people will find that, if there is a lack of sleep, there will be some sort of anxiety, depression, and so many other issues coming. How can we explain that?
See, when a child is born, it sleeps almost 16 hours to 18 hours. When especially during the teenage growth, the children until teenage and all, they need at least 8 to 10 hours of sleep. Around 10 hours of sleep is needed, especially in the teenage growth, because during the sleep time, these hormones, actually all these hormones are secreted, the central hormones coming from the brain. Melatonin is taking place, taking major part, and also thalamic hormones. There are the super controllers. And next level is the hypothalamus. And this pineal gland, the thalamus and hypothalamic hormones are controlling almost all the lower level hormone systems also. So for the growth, it is very important. The sleep is very important, because then only this hormone secretion will take place normally. then when we get adult, that sleep requirement will be reduced. But generally speaking, 8 hours sleep is needed. But depends on each person. That is 6 to 8 hours will be okay. But there are some super power persons, like they're basically some sort of yogis and all. They can induce some certain different quality of sleep. They will be very motivated, and their brain will be functioning in a different way. We have heard of our own major personalities, they sleep only 2 hours and 3 hours. That is because of their motivation, and also they will be having a very systematic lifestyle, proper way of exercising, proper way of focusing on what type of activity they are doing. Because if they are only focused on their own country, the very big leaders who are focused only on the development of the country, and they will be having a systematic lifestyle, they will be that it will work in a different way in them. But the common man, they need around 8 hours of sleep. And that sleep quality also matters. If you're sleeping for 8 or 10 hours after taking alcohol, it is not a good quality sleep. There are many people who is taking alcohol for getting sleep. So the alcohol is a suppressant. Actually, it is not giving you good sleep. You will be in some sort of sedation. That is not a good sleep. If you want to have a good sleep, have a very good day's work completed with some physical activity and mental activity, you'll definitely get a very good sleep. If you are not doing any physical activity and you are stressed up in the whole the day, definitely the stress level will increase if you don't have physical activity. That is our problem. The modern day problem is that actually the hormones coming out from the muscles and the bone, it is actually making so much changes in our, actually we think that the brain is controlling, but the latest studies are showing that it is not the brain which is finally controlling. It is the input from the outside. The light which is coming falling into your eyes, and also the sunrays which is falling on your skin, and the fat which is subcutaneous fat, and even this muscle and bones which is when it is stimulated, it is making some myokines and osteoclast, another hormone from the bone. These are actually finally giving orders to the brain how to work. So it is all interconnected. So it is your physical activity, mental activity, everything is connected. And it is how much sleep you want is also depends on your motivation, your energy level, and your training of the brain. So many factors are involved in it.
Another common issue that we face in the modern day is that earlier, maybe quite some time back, since there was no electricity and all, everyone used to complete their daily activities at sunset or slightly later. But now what happens is sunset doesn't affect activities. Many a time activities begin at sunset also. So what is the role of regularity in sleep? Because when you are a student, you have the school timings and all, which make some sort of control over the timings of your life. But after your schooling, then the timing limitations are gone. So how does a person understand that having regularity in sleeping is useful to him?
See, there is an internal clock working inside our body, and there is external clock which is controlled by the sun and the earth's swing movements actually. So it is always good to go with the nature. So get up around the time of the sunrise and go to sleep in the night. But in the modern day, many of the people are working for the other side of the country, world actually. From Indians maybe working here from to US, and they will be in the opposite way and all. So that's make a lot of changes in our body also. So always try to be with the nature, but unfortunately if you are not able to go and keep the timing, I don't know, usually there is 3 shifts will be there and the shift will be rotating. I always think that why can't everyone can be put the same shift so that they can continue, because every person was when they get a sickness also, they complain that because when the shift is changing they find it very difficult. So that is actually that then again those who are working in the shift, night shift and day shift, and 3 times, so every week or every 2 weeks it will be changing, that it will take the body to adjust with that. So that is a problem that we cannot solve with the medication. But yes, definitely we can help them with the medication, like that is actually melatonin, that hormone which is produced by the brain, that is pineal gland at night. But if the person unfortunately has to start sleep at 10 o'clock in the daytime, so he will be finding it difficult. So with our modern facility we can make it a dark room. Definitely if the person is sleeping in the day, forced to sleep in the day and work in the night, he should or she should have a proper dark room for sleeping. And also when you shift the night duty or the shift in the duty, you can use 1 or 2 days this melatonin sort of hormone tablets, and then do it in the regular timing. That is very, very important. If you want to change the time 1 or 2 days, you can this regularization this hormone you can take, and then if you keep on that, then naturally it will come, because your brain will be brain understand that you want it that way. But if you are going and if you are in the daytime, there is the ladies usually find it very difficult that with they come after night duty and there will be small children will be there. She has to look after the children feeding, and then they won't get to sleep, and it will naturally lead to diseases. Actually, if the person who's especially doing night duty and not getting enough opportunity for sleep, this is actually bringing all these lifestyle diseases like even diabetes, hypertension, cancer, autoimmune diseases, everything. And one of the reason is lack of sleep, and which will naturally reduce the efficiency. This cognitive impairment will come, and definitely it will affect your job. And when the job is not going properly, that again will be increasing the stress level. So it will be, and even if you are able to lying down, also you will not be able to sleep. So many factors are actually coming together. The lifestyle factors basically.
Actually, you are talking about lifestyle now. Often you mention that the food that one consumes also affects the sleep. Generally, we think that if you take sufficient food or even have a slightly excess of food, you will get a good night's sleep. That is generally what many people believe. But I think you are of the opinion that that food has a very big role in giving sound sleep. And what do you think are the important things people should consider about food to get good sleep?
See, for having a good sleep, it is always take your food at least 2 or 3 hours before sleep itself. So, olden days in our part of in our country, generally people consider that before 7 o'clock you have to take your food, and but after the time for the last few decades and all, it's most of them are taking night 9 o'clock or 10 o'clock the dinner. So with a full stomach, it is going to sleep can produce so many problems. Especially there are so many taking alcohol also. So it will create the problem is the stomach is full, and when the stomach is full, the intestine has to work. So you are not really getting sleep. You are not getting rest. If you get a proper rest, even there is not much food in the intestine, the absorption will not take much of the energy actually. But this chewing, that the stomach activities, actually it is turning the food and like a mixie. So it really needs energy. So if it is the stomach is full and the stomach is active, then your heart will not get enough rest. Heart has to pump for this stomach, and all the stomach is full, and it can the fluid can regurgitate into because it's a full stomach. If you are going to for a sleep, your this fluid from the stomach get into, because it will be very acidic, and that can become one of the reason for the sleep apnea and sleep problems and lack of sleep also. So even the food content, the food, what type of food you're eating. If you're eating the food with caffeine or this cocoa, that is chocolates and things. And even for my experience, I have seen people who if they are taking this nuts and all, because that is very high in omega-6, the sleep can be get affected. And also in each person, some food may be allergic or intolerant, or the body may be reacting. Even I have seen people who they are able to, because of the already the lifestyle, clinically supported lifestyle correction, the people can find out which is actually creating problem from them. There are people who says that this restless leg syndrome and sleeplessness, and they pinpoint which food it is creating. Actually, with the blood test itself, we get an idea about it. But even though there is, it is showing allergy or intolerance for the person, they may take it. And then when it is, we are noting it down on this chart thing also. So from that, if that one day they are not able to sleep, we can find out the reason for the lack of sleep, if there is anything with the food, connected with food also. So food and even so as earlier said, the medication also. Some of the medications can lack of sleep and oversleep and daytime drowsiness, and all this food, medicine and activities, physical activity also. If you have a very good physical exercise, you will get a good sleep definitely. So otherwise you should have a pain which is preventing you to sleep.
What role actually does age play? Because generally we say that, as you said, small infants need more sleep. As they go older and older, a person requires less sleep. But at the same time, we find that as a person grows older, generally, it is not like he sleeps, but he is having some sort of fatigueness associated with general time. So it is something like half a sleep and all that. So what is it?
That is because of the illness. So when you are getting old, you will be getting lifestyle diseases like diabetes, hypertension, fatty liver. All these things comes at an age. So these diseases are the associated problem, and also the medications, which both will be reducing the sleep. Another, the natural mechanism which is happening also in the brain, this melatonin secretion can come down, and that is the sleep inducing hormone, that cells will be getting reduced, like especially the neurodegenerative diseases like Parkinson's disease, Alzheimer's disease, and dementia also is another sort of, actually, this brain reducing the size of the brain. That is very common, especially those if you do an MRI, the brain size will be started reducing, that their memory will be reduced, and it started actually before this Alzheimer's disease symptoms, external symptoms shows. Those sort of brain changes is already taking place. And one of the major reason is this fat accumulation in the body. When you are in the younger age, you will be trim and lean and all. But what is the difference between now with today? The children also is obese. But in the olden days, if you take 50 years or 40 years back photos and all, generally people are very lean. Only when they are old, they are accumulating excess fat inside in the body, and even that is actually increasing the chance of this sleep apnea, and this snoring and sleep apnea is so common only in the older people. But it is changing now. It is the children also. That is because of the early, actually accelerated aging happening in the children, because of this accumulated toxins. Even the excess fat in the body accumulating is also a toxin, and this all is affecting the brain also. Even you should understand that the brain is made of fat. The brain, most of the brain content is fat actually. In the muscle we know it is protein, but for the brain it is fat and water mainly. So the quality of the fat also is very important, especially for these neurodegenerative diseases, which all the neurodegenerative disease is having an impact on the sleep also. this hydrogenated fat. That is also a modern thing. Actually, the hydrogenating this fat, and it gives the quality of the fat will be entirely different. And this hydrogenated fat is used for building up the brain cells or the support cells of the brain. So that will also produce the not only the sleep quality, that the cognitive and your intelligence and memory and everything will be affected.
Generally, now we got a rough idea about the different aspects of sleep issues. What are the common diagnostic tests? See, we can understand if we are not getting good sleep. We can understand if we are drowsy and all that, there is some sort of issue and all. But what are the tests that we can do where we can be sure, okay, if I do this test, I can find out if this is wrong with my sleep?
See, there are very effective tests, that is polysomnography. So that is very effective in finding out, and it has the hospital admission. There are other equipment like this, some apps and all, which is connected to your smartphone and all, but that will give only partial awareness about what is happening. And also, even you can, the simplest way is you can put a video camera and see what is happening, whether you're snoring, whether you're getting a good sleep. Externally we can know, but professionally now there is a sleep is itself, it's a specialty, it's growing as a specialty. Sleep clinics are there, and in there will be this polysomnography testing is there, and it is a very elaborate test actually, where you are given a special room, and it will be, that is actually called a lab, sleep lab. And the ECG, the brain EEG, brain activity will be, the ECG leads will be there. Then the eye movement, the rapid eye, the sleep has different phases and all. So what is happening in the brain, and also the eye movement, and the nasal airflow and the oropharynx, that throat airflow, and even the chin activity. There are people, the people who's grinding the tooth or bruxism, that sort of problems can also there. So even that can be checked, and also this restless leg syndrome, we can, that also will be connected, and even the ECG, which will, one of the lead, not all the leads, but which lead will be connected. And also the breathing movements, whether you are getting a sleep apnea. So for that, some sensors will be connected in the chest and the abdomen. So it's a very elaborate test, and you'll get a very good idea about it. But only thing, you will be in a different atmosphere. It's in a lab, so that sort of discomfort, and it is not in a natural setup, because you are putting all these things on, you are attaching all these things on your body, so it is not a natural sleep, but you'll get a very good idea about the sleep. This is called a sleep study. And other things you can watch, and even you can, if you are sleeping with someone, they can also assist you in providing. But definitely, if you are very sleepy and if you are overweight, when obesity is there, or if you are having other diseases like even need not be obese also, just to overweight itself, you should definitely, and if you sleepy in the daytime, you are not able to concentrate, where you are sleepy during driving, definitely you should think of a sleep study. But remember one more thing, but sleep study alone will not correct your sleep problems. You have to find out, and then you have to correct it. And that is, correction will be mainly through the lifestyle changes only. That then during the treatment we can discuss all these matters.
Now we have gone through basically the reasons, then what is it that we can consider as sleep disorders, then how to diagnose it from a patient point of view, how to diagnose it from a medical point of view, and also get a picture about what are the complications and other issues related to sleep issues. In the next part, we actually look at what are the available treatments in the current medical healthcare system that can help in overcoming such sleep disorders. Thank you.